जी अस्सलाम वालेकुम। ये कैमरा पोजीशन ठीक है और आपको साउंड लाउड एंड क्लियर आ रहा है?
हाँ जी जी, बिल्कुल बिल्कुल क्लियर है। और साउंड भी ठीक है।
जी आपको ये कैमरा पोजीशन ठीक है, प्लस आपको हमारी साउंड लाउड एंड क्लियर है मैडम?
हाँ जी बिल्कुल, आपकी दोनों कैमरा पोजीशन भी सही है और साउंड भी क्लियर है।
ठीक है, थैंक यू मैडम।
थैंक यू।
Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. First of all, I request all the esteemed guests and audience to rise from the seats for the national anthem. Respected Vice Chancellor, Professor Khalid Sood-Gondal. Respected Principal, Professor Noreen Ahmed, Registrar of Fatma Jinnah Medical University, Professor Nadeem Kasuri, Professor David Hotiana, Professor Abdul Hamid, all the respected faculty members, and dear students, good morning and assalamu alaikum. I really warmly welcome our esteemed guests, our foreign delegate, who has come especially to address all of you on this special day. Before I proceed further, I request Mohidissa, student of fourth year, to kindly come to the stage for the recitation of the Holy Quran.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. اقرأ باسم ربك الذي خلق. خلق الإنسان من علق. اقرأ وربك الأكرم. In the name of Allah, the Merciful, the Beneficent. Read, O Prophet, in the name of your Lord who created humans from a clinging cloth. Read, and your Lord is the most generous, who taught by the pen. taught humanity what they did not know. صدق الله العلي العظيم.
Now I very warmly welcome the esteemed foreign panel who has come today to address our faculty and students on behalf of the Vice Chancellor and the Academic Council of Fatma Jinnah Medical University. First of all, I'd like to introduce Dr. Richard P. Moser and Mrs. Richard as well. Professor Richard is Professor. You would love to know Professor Richard is Professor of Neurological Surgery and Radiation Oncology at University of Massachusetts Medical School, and he is a Senior Scientist, Horai Gene Therapy Center. We are also honored to have Professor Franco Sarvati, Department of Neurosurgery, Humanitas Clinical and Research Center, IRCCS, Department of Biomedical Sciences, Humanitas University Milano from Italy. And last but not the least, we have Professor Gail Roggio. She is a clinical professor of Professor Gail is a clinical professor of neurosurgery from George Washington University. Also, she's adjunct professor of global neurosurgery, Barrow Neurological Institute, and she's chairman board of directors of the G4 Alliance. Thank you so much, and a very, very warm welcome to the city of Lahore, Pakistan. You would be very happy to know that Fatma Jinnah Medical University, created in 1948, is the only woman university of the subcontinent. And this is one of the mentorship sessions we run with the students, and we are proud to have you as our mentors. Thank you. Where we talk about mentors and where we talk about surgeons, by the way, I am a physician, but I am daughter of a surgeon. So I have a very close relationship with surgery, and I was just digging into the history because this is a very historical institute. One of the first surgeons, one of the first neurosurgeons, you must be knowing the history dates back to the 6th and the 7th century. And one of the first surgeons ever noted in history was a female. And her name was Rafeda al-Islami, and she belonged to Arab. She was born in 620, and she embraced Islam, and she was one of the first Muslims, first Muslim women to embrace Islam. And very interestingly, as the history says, that she started her journey working with her father. Her father was a physician of that time, Saad al-Islami. And she started working with her father. And when the battles of Makkah and Medina took place, she would take care of the ailing soldiers who would come from the battlefield. And she was #1 founder of the battle hospitals. Then very interestingly, she founded the first mobile care unit ever in history. She was a female. And she was one of the first few women who drafted the first code of conducts and ethics for nursing. And the fifth is that she, with the permission of the Holy Prophet, peace be upon him, she created a tent in Makkah, in Medina. And that was for the education of general people regarding healthcare. So it was a preventive care unit. So this was what women were up to back in the 7th century. And this is a propagation of what we are heading to. One of the only few neurosurgeons of Pakistan is sitting in the hall, Dr. Fauzia Sajjad. And along with all the teachers sitting on the stage, and that I'm very proud to say includes myself. She is a very proud alumnus of Fatma Jinnah Medical University. Thank you, Professor Fauzia, for joining. With this, I'll request our respected teacher, our principal, Professor Noreen Akmal, to kindly come to the dais for a little introduction of this great institute.
Bismillahirrahmanirrahim. Respected Vice Chancellor, Fatma Jinnah Medical University, Professor Dr. Khalid Masood Gondal. Respected guest speaker from George Washington University, Professor Gail Russo, Clinical Professor of Neurosurgery. Professor Richard Moiser, Neurological Surgery and Radiation Oncology Department, Massachusetts Medical School. Professor Franco Sarvedi, Department of Neurosurgery and Humanities, Clinical and Research Center, IRCCS. Professor Naveed Ashraf, Professor of Neurosurgery, ex-HOD, Head of Department, Allama Iqbal, Department of Neurosurgery, Allama Iqbal Medical College. Organizer for this lecture, Professor Abdul Hamid. He is Dean of Neurosurgery at Fatma Jinnah Medical University. Respected deans, registrar of the university, respected professors from Fatma Jinnah Medical University and other institutes of neurosurgery, my dear faculty members and my dear students, it's my proud privilege to welcome you all to this guest lecture by Professor Gail Rosso. She's going to talk about women empowerment in global neurosurgery. And Professor Gail, I assure you, we have full empowerment, women empowerment at Fatma Jinnah Medical University. I'm going to give a brief introduction and a brief history of our institution. Pakistan was created in 1947, and at that time there were only 2 functional medical colleges in Pakistan, and there was acute shortage of female medical doctors. So at that time, this college, that is Fatma Jinnah Medical College, was founded in 1948, and its name is after the name of the founder of Pakistan, Quaid-e-Azam Muhammad Ali Jinnah's sister, that is Fatma Jinnah. So this college started in 1948. And in 1948, the first batch of students consisted of 39 female medical students. The peculiarity of this college was and still is that this is only for female medical students, undergraduate level. So formal inauguration was done in 1948. And this is the first batch of Fatma Jinnah Medical College with Muhtarma Fatma Jinnah in the center. And this is the first convocation in 1953 of the first batch of students from Fatma Jinnah Medical College. And this is another group photo with the Mohtarma Fatima Jinnah. It will not be fair if I mention Fatima Jinnah Medical College and I do not mention Sir Gangaram. Because before this college came into being, before the partition, there was a medical college in the name of Balakram Medical College. When India and Pakistan, there was partition of the subcontinent, Balakram Medical College was closed and all the doctors and the teachers, they shifted to India. So this institution was initially Balakram Medical College, and after partition, it was named Fatima Jinnah Medical College for Women. And Sir Gangaram is the person who made this college as well as the hospital, that is Sir Gangaram Hospital, which is the affiliated hospital of this institution. And Sir Gangaram Hospital, we will go, inshallah, if you will have time, we will take you over there to Sir Gangaram Hospital as well. So the Sir Gangaram Hospital made Sir Gangaram Hospital, and it is still the teaching hospital for the students of Fatima Jinnah Medical College. So this is the building of Sir Gangaram Hospital, and he is the grand person, Rai Bahadur Sir Gangaram. In 2015, madam, this college was awarded the status of the university on 1st of July 2015 by the government of Punjab. And now Fatima Jinnah Medical College is a constituent college of Fatima Jinnah Medical University. Fatima Jinnah Medical University is the parent institution to multiple hospitals, and Professor Khalid Masood Gondal is going to discuss in detail about the university, so I will not go into the details. Fatima Jinnah Medical University is recognized by Higher Education Commission, PMDC, Pakistan Medical and Dental Council, and the College of Physicians and Surgeons, Pakistan. It has fully functional examination department, registrar office, Department of Medical Education. I am heading the Department of Medical Education as well. Quality Enhancement Cell, Office of Research, Innovation, Commercialization, and we also have Office of Business. We also have Business Incubation Center, BIC, in the university as well. Regarding the students of Fatima Jinnah Medical College, we have graduates from our country, and we also have students from other nations. We have students from Nepal, Sri Lanka, Maldives, United Arab Emirates. We also have students from some of the students who from USA as well as from UK. So we have a mixed diversity of the students at Fatima Jinnah Medical, but all of them are female at undergraduate level. All the students, they are female. So these are the students, they are holding their flags of their nations. So this shows the diversity at our institution. So these are the different departments of Fatima Jinnah Medical College, basic sciences, and we also have clinical sciences as well. There are some things in which we feel we mention them very proudly. One of them is Punjab Thalassemia and Other Genetic Disorder Prevention and Research Center. Madam, this is the biggest thalassemia prevention program of Asia, or I think in the world as well, because initially it was Punjab Thalassemia Prevention Program, and now the name has been changed because we are dealing with the other genetic disorders. So the institute is now called Punjab Thalassemia and Other Genetic Disorder Prevention and Research Institute. We are very proud of this institution. And another thing which we feel, I am an obstetrician and gynecologist, this is Mother and Child, Fatima Jinnah Institute of Mother and Child Health. It has been built, it is purpose-built hospital. It is catering for 4 subspecialties of obs and gynae. We are developing urogynecology, reproductive endocrinology, we are developing maternal and fetal medicine, and as well as gynae oncology. So this is going to be a state-of-the-art. It is going to cater for the whole Punjab, inshallah ta'ala. And we are proud of it. Just to mention a few words about the Department of Neurosurgery, because this lecture has been organized by the Department of Neurosurgery. Professor Abdul Hamid is the Dean of the Neurosurgery. And regarding the women empowerment, you can see there are 14 postgraduate residents and 11 postgraduate residents are female in this department. So next time when you will come, you will see 100% female empowerment in the Department of Neurosurgery as well. So I'm going to end my presentation over here by this saying of Quaid-e-Azam Muhammad Ali Jinnah, the founder of the nation, that no nation can ever be worthy of its existence that cannot take its women along with the men. No struggle can ever succeed without women participating side by side with men. Thank you so much.
Thank you so much, Madam. Beautiful words by the founder of nation, women participating side by side with men. When we talk about women empowerment, how many of you know that we are going to celebrate Women's Day? When do we have Women's Day? Excellent, 8th of March. So March is the month of women. And every year, Fatma Jinnah Medical University holds several events in celebration and commemoration and in respect of the women. But please remember that whenever we talk about women empowerment, we need to have a support system. And Alhamdulillah, by the grace of Allah Almighty, Fatma Jinnah Medical University is very privileged to have its leader as a man who encourages women and empowers women. So I'll take this honor to request on the dais our respected Vice Chancellor. Thank you, sir, for always supporting us, encouraging us. Kindly come to the dais for your precious words of wisdom.
Bismillah ar-Rahman ar-Rahim. On behalf of Fatma Jinnah Medical University, I welcome the very esteemed guest from US and other countries, Professor Gale, Professor Richard, Professor Franco, and other colleagues, and the eminent neurosurgeon from other institutions, they are there. I welcome Professor Asif Bashir, the CEO of Pakistan Institute of Neurosciences, Professor Shahzad, Professor Fawzia, Principal Professor Noor-ul-Huda Akmal, our Deans Abdul Hamid, Professor Bilqis Shabir, Naveed Ashraf, Naveed Hotiana, faculty member, and very dear students of Fatma Jinnah Medical College and the university. I think very well elaborated by the Principal Professor Noor-ul-Huda Akmal about the history of Fatma Jinnah Medical College, the first institution after the independence. And currently, this affiliated institution of Fatma Jinnah Medical University have got over 1,500 students. And we have got, along with this institution, other affiliated like the Female Nursing College, the Male Nursing College, and paramedics. And along with that, our guests will be happy to know that we are having the maximum number of postgraduate program from college side, from university side, the medical allied and the surgical allied, main specialty, super specialty, subspecialty program, 4-year, 5-year, 6-year program. And along with that, Fatma Jinnah Medical University have got many unique peculiarities. Already mentioned by Professor Noor-ul-Huda Akmal, the world best program of prevention in the form of the Thalassemia Institute of Prevention and Other Genetic Disorder. Similarly, the MCH, Mother and Child Center, 550 beds with 4 new subspecialty programs like gynecological oncology, urogyne, infertility, reproductive medicine, fetal medicine, and we have got the 4 professorial chair in that institute. And along with that, the university was last year declared as one of the best university, and one of our faculty member was declared as the best university teacher from Higher Education Commission of Pakistan, Professor Kamran Khalid Khaja. And I think Professor Gale was talking about the artificial intelligence. And we are going to establish, inshallah, the Department of Artificial Intelligence in this university. And we have already the Department of Telemedicine. And during COVID, we have the experience of teleconsultation. Professor Bilkis Shabir, I think one of the founder of telemedicine, she was at that time at King Edward Medical University, and department was established at King Edward and the Fatma Jana, and around 80,000 people, they were given the teleconsultation during COVID from 33 different countries and from 85 different districts of Pakistan. And that is, inshallah, we are going to establish on permanent basis. And because of that innovation, Professor Bilkis Shabir was recommended for Presidential Pride of Performance. And on 23rd March, President of Pakistan is going to honor Professor Bilkis Shabir with Presidential Pride of Performance. And another thing with Fatma Jana Medical University and College is the alumni. We are proud of our alumni in US and other country, and Association of Old Graduate of Fatma Jana Medical University. And one example with this university has created is the flood relief activity. During the flood challenge, the Akashani village in South Punjab was adopted by this university, and that village is now named as a Fatma Jana village. And we have looked after 300 houses. We established the dispensary, the community center. We looked after that school, and our faculty is regularly visiting that institution, and that is being permanently looked after by Fatma Jana Medical University. Now coming back to Professor Abdul Hamid and his department, we have got all the facilities, state-of-art facilities in the neurosurgical department, and the training program in all postgraduate program, especially in the neurosurgery, that is one of the best. At Fatma Jana Medical University, we have got the competency-based medical education, which started in 2008 in Canada, CanMed, then ACGME competency of US. In Fatma Jana, we have got the competency-based medical education, and we try to match the instructional strategies with updated curriculum, with the training framework, with monitoring through the e-log system and evaluation. And we are introducing the innovation in our evaluation system. Professor Abdul Hamid, Professor Qasim Bashir, their faculty and other faculty have now introduced the workplace-based assessment for postgraduate resident. And that is a sort of the formative assessment, so that you cannot assess a student in 1.5 years as a summative assessment. So in this way, we are trying to introduce the innovations in the medical education. So Fatma Jana Medical University, on the side of the academics, the research, infrastructure development, international liaison, is trying to one of the best university of Pakistan and one of the best in the world. And I'm very grateful to our esteemed guest from US and other country. I think today's seminar is one of the most important seminar as far as the mentorship program is concerned, as far as the specialty of neurosurgery is concerned. I was just discussing Qasim Bashir with them about your, I think you are one of the initiative of that thing, 2 + 3, 1 + 4, 1 + 6 year, the residency program of neurosurgery. And I'm sure after this seminar, we will come up with some good lines as far as your specialty is concerned. Professor Abdul Hamid and Professor Naveed Ashraf, thank you very much for organizing, for facilitating this seminar. And I have invited my guest to Karachi CPSP. Probably they have got the short time. And inshallah, next time they will be visiting to College of Physicians and Surgeons, Pakistan. Thank you, and thank you very much.
Thank you so much, sir. And believe you me, every day, all of us, the faculty and students, are grateful to Allah Almighty for blessing us with a patron and mentor like yourself, who always supports women. Today, the topic of today's seminar is women empowerment in neurosurgery. And Professor Gale, our guest speaker, she's going to talk about spina bifida. In order to tell you what spina bifida is, I request very respected Professor Naveed Bhutiana. who is Professor and Chairman of Department of Pediatrics and Dean Faculty of Preventive Health, Padma Jinnah Medical University, to come to the stage and introduce the subject to the students and the faculty.
Bismillahirrahmanirrahim. Honorable Vice Chancellor, respected faculty, esteemed guests, I really feel privileged and honored to be here in front of such a learned faculty audience. I'm a pediatrician and I feel stuck in between gynecologists, radiologists, and prospectively between neurosurgeons and interventional people. But so far, pediatricians, they are favorite. Collaborating between all those people who diagnosed in utero, later on with radiology, and subsequently evaluating the patient to the neurosurgeon. So mostly the parents, they are emotionally, they are more bonded with the pediatricians. So I will be very brief, and the topic will be divided in three things: and what the spina bifida is, how much workload we are catering, and what can be the futuristic options for us to establish a state-of-the-art spina bifida center. So what it is basically a failure of closure of the neural tube, and the third or fourth or fifth week of the embryonic period. It has two types. Failure of the cranial closure will be called decrania, and then spina bifida, failure of the caudal closure. And sometimes it is open, sometimes it is closed. So for undergraduates, students are here. Just a pictorial things about anatomy. The structural anomalies, open spinal bifida, closed spinal bifida, and central C and licensed cavity. That are the structural defects of the patient. This is basically we do have these people from the referral from the gynae. The baby is born with the neuromyelitis because it is just a diffusion of the superficial layers, and the long with that is the spinal cord is between the cord and the So neuromyelitis is the protrusion of the spinal cord along with the meninges, meningocoele, and spinal bifida. This is very common because when we do the newborn examination, the spine is must. After this conference, we feel every spine must be examined in utero, before birth, after birth, because spine is something that is neglected everywhere. Eventually leading to a very crippling life for the babies, leading to eventually renal failure and a lot of other issues. So if you find some tuft of hair, some lipoma, some sinus formation on the sacral area, so it's an alarm. What are the different risk factors? Again, they start from the maternal side. Here in Pakistan, in collaboration with WHO, all the pregnant mothers in the family are being provided with the knowledge and vitamin deficiency, just body sort of purity effect. Lot of other maternal factors like gestational diabetes, obesity, the use of drugs, anti-inflammatory drugs, they can lead to the neurosurgery effects. And sometimes the genetic things like trisomy, trisomy 30 and 80 chromosomal defects, even they are associated with the neurosurgery effects. Antenatal scanning is very common, but in Pakistan, there is a very high burden of unattended births. And a lot of other deliveries who are having no antenatal care. So, and along with that, spinal cord defects, we can have some other structural problems like hydrocephalus, we can have a clubfoot, typhoid malformation. So these are the associated structural defects along with the neurotic defects. So natural history of spinal bifida, risk of preterm delivery obviously is 15 to 20%, and it is very apparent on the scans. And mostly we need neurosurgical closure. We need neurosurgical closure within 24 hours, and if it is associated with the hydrocephalus, then that patient might need some beauty cancer. So subsequently, they do have ambulatory motor and sensory dysfunctions, generally and bowel function we have to take care of, and we are concerned about the neurodevelopmental and the quality of the life. this is something that is alarming because all over the world, the incidence of spinal bifida is already on the lower side. It is only 0.5 to 1%, 1,000 pregnancies in Europe, Asia, and America. But in Pakistan, it is going up to, in the local studies, 12 to 14 per 1,000 live births. A study that was conducted in Islamabad, and that was conducted by the people who are working in the anatomy department. They examined the human sector, dry human sector, and they found 34.5% all of those dry segments, they were having structural defects. So that was very on the higher side. So it shows it's just because the iceberg that we are dealing with. So these are the local data that are presented. What we are having here, we are having patients who are, I mean, the things are working in a parallel. There is no synchronized and properly established spina bifida centers. Like we as pediatricians, we get patients from the obstetrical department. When the calls come and they say that the baby is having some spinal defect, what we are supposed to do? So one is that source of patients. Inborn delivery, sometimes deliveries are born and they refer the baby with the mother because he is having a spinal cord defect. And obviously from the area where the tertiary level hospitals are not there and they are referred by the patient that are accompanied by the parent about this neurotic defect. So the things are not working in a synchronized and a functional way. So the only thing we need to do, keeping in mind. So this is the main thing. So far, Madam rightly mentioned about mother-child health center. We have a very high burden of deliveries. We are getting 80 to 100 babies per day by C-section, by normal delivery. So it's a very high growth rate. And almost 2,500 deliveries per month. And we in our neonatal care units, we are getting 500 admissions per month. So it's a very high, but the things are being getting neglected because we can't do everything. There must be one forum in which, again, every spine must be inspected by the radiologist, it must be done. So, what recommendation that we do have to on the preventive side and the therapeutic side? All the mothers who are pregnant, they must be provided with folate and B12 deficiencies to the mother, effective anti-interstaining and collaborative effort. Somehow these are the fetal drugs about the fetal surgery and the early involvement of the neurosurgeons. Well, this is the main thing. I talked to Professor Pizza, we must establish a total state-of-the-art spinal bifida center, which must be having collaborative efforts from these stakeholders, meaning from the pediatrician, from the gynecologist, from the radiologist, neurosurgeons, daily health workers who are working in the masses at the community level, and administrative health officials who can, provide the logistics for the proper referrals. So there must be one center who must be dedicated in the screening, on the preventive aspect, on the therapeutic aspect, early involvement of the neurosurgeons. So this is just I shared with Dr. Hamid as well. We must have some robotic surgery, some fetal surgery. We do have all the facility. We just need a cooperation from you people because the thing we talk a brain again. We want to have a brain again. We want to involve you people to save the babies crippling, to avoid the crippling in their life. So this is something. There must be some robotic surgeries, fetal surgeries in such a hospital in which we do have such a high burden of the patients. Because the patients coming here, they are not in the normal frame of mind. It means they are handicapped in the form of emotional ability, poor income, disease burden. So we must be here in collaboration with you people to hold their hands to take them out of it. Thank you so much.
Thank you so much, Professor Abdul Hamid. And this is a beautiful depiction of how, inshallah ta'ala, we are looking forward to a center for spinal bifida at Fatima Jinnah Medical University. talking about spina bifida and neurosurgery, neurosurgery is a tough field. And it is said that you do not know, a woman is like a tea bag. You do not know how strong she is until you put her in hot waters. So, I think Professor Gale would be the best person right now to tell us how a woman having put in hot water would feel like. In order to introduce Professor Gale, I like to request Professor Naveed Ashraf, Professor of Neurosurgery, having retired from Allama Iqbal Medical University, Allama Iqbal Medical College. And sir, we are very grateful to having facilitated this event for us. Thank you, and kindly come to the dais for introduction of Professor Gale.
Bismillahirrahmanirrahim. Thank you very much, Professor Shabir, and Professor Khalid Masood Golden, the worthy Vice Chancellor, Professor Noor-ul-Huda Akmal, the Student Principal of the Fatima Jinnah Medical University College, Professor Abdul Hamid, my great friend and younger brother, who has made his mark in Fatima Jinnah University as a neurosurgeon. Thank you very much, my esteemed faculty and dear students, to give us this honor to be with us. You are with us today, and we are very happy to be here with you today. Now, before I introduce my star speaker, Professor Gale Rousseau, I would like to acknowledge the presence of a couple of people over here, first and the foremost, and in a different manner, because I would like to introduce Professor Franco, who has already been introduced previously. Professor Franco Severdi is actually the honorary president of the World Federation of Neurosurgical Societies. He's also the past president of the Italian Neurosurgical Society. I would also take the opportunity to introduce Professor Richard P. Moser, who currently works in Massachusetts Medical School, but his primary interest is that he's working on the cutting-edge gene therapy in brain tumors. I would also like to acknowledge the presence of few other luminaries in neurosurgery, Professor Asif Bashir, who is the Dean of Punjab Institute of Neurosciences, Professor Shehzad Hussain, who is the professor of neurosurgery, and he's also heading a unit in Punjab Institute of Neurosciences. And the last acknowledgement actually makes me more emotional. It is due to the fact that the last acknowledgement is about a lady whom I had the privilege to mentor as my first resident, and she's Professor Fozia Sajjad. Would you please rise to be acknowledged? And of course, now I'd like to introduce my star speaker, Professor Gale Rousseau. Dr. Rousseau is Clinical Professor of Neurosurgery at George Washington University School of Medicine and Health Sciences in Washington, D.C., as well as an adjunct professor of global neurosurgery at Barrow Neurosurgical Institute. Her areas of expertise include pituitary and skull-based surgery, microvascular compression syndromes, and stereotactic radiosurgery. Her clinical practice currently is focused on veterans, particularly in the area of traumatic brain injury. She has been involved in global neurosurgery all of her career and is a leader in the global surgery movement. In 2019, she and Jeffrey Brown co-founded the Global Alliance for the Prevention of Spina Bifida, a joint initiative of G4 Alliance and the International Society for Pediatric Neurosurgery. She is a member of Alpha Omicron Alpha and is the current section editor for global neurosurgery for the Neurosurgery Journal, which, mind you, is one of the top journals in the world. She has served as the chairman of the World Federation of Neurosurgical Societies World Health Organization Liaison Committee and is currently on the executive board of the WFNS Foundation and vice chair of the G4 Alliance, which includes surgical, obstetrics, trauma, and anesthesia. She has long served on the board of directors of the Foundation for International Education in Neurosurgery and of Think First, the International Head and Spine Injury Prevention Program. She has been elected to leadership positions in the American Association of Neurological Surgeons, Société de Neurochirurgie de la Chaussée, and WFNS. In 2021, she was honored with the ANS Humanitarian Award. I now welcome Professor Gail Desai.
Thank you. Thank you very much for your very warm welcome. I'll start by saying I will never think of a bag of tea the same way again. I very much like what you said about tea bags and strong women. Can't you just feel the hope and optimism in this room? It is sensational. Your enthusiasm is really warming my heart. And I just can't help but think that maybe we're at some kind of wonderful turning point in the world. We've just heard from your enlightened leadership. We know now about these wonderful programs you have in place. For example, the way you on March 8th are celebrating with WHO and the United Nations and the rest of the world, the possibilities that are being unlocked by giving opportunity to the other half of the human population. How can we not make progress in a situation like this? So I'm just delighted to be here with you on this occasion and at this time in history. Thank you, too, for allowing me to speak to you about something that is near and dear to my heart. This talk has been very well set up by our colleague in pediatrics, because what we're trying to do with spina bifida is really our first step in trying to bring a remedy to a problem, and that is that not enough people in the world have access to good quality surgical care. So this is our first venture into preventing a surgical condition, with the net result of a real brain gain, which is a term that I learned from your esteemed leader here. So I'll be talking to you about the global surgery movement and how spina bifida fits into that. But I hope that each and every one of you, as we're talking about this topic, will think about what you can do and what role you can play. There is absolutely so much to be done and so much passion, enthusiasm, and intelligence in the world. We need your energy and dynamism in this effort. So let me begin. Thank you to my colleagues here. And now let's begin. And I want to start with the definition, and that is that global neurosurgery, like global surgery, is the clinical and public health practice of neurosurgery. In our global world, we have realized that in the last 30 years or so, that physicians are now starting to take on two primary professional responsibilities. The first is the one that we've always had, to take the best possible care of the patient in front of us. But the second in our global world is to recognize that we have a responsibility to use our knowledge and skill for those other people around the world, our colleagues in our specialty and their patients, so that we can bring care to everyone. So there's a second core professional responsibility, and that's what we're talking about today. Now, we've talked a little bit about history. The history of this movement is quite new. In fact, this slide talks about really when we as a world community started talking about global surgery in a big way. And that is because the Lancet Commission report on global surgery, which was published in 2015, came up with these takeaways. You can read the 85-page report, but the main themes are on this slide, and they are a real challenge to us all. You can see that it shows that of the 8 billion people on Earth, 5 billion with a B do not have access to even emergency and essential surgery. And that means that there are about 143 million urgent surgical operations that should be done every year that can't be done because there's not enough surgeons, and those that we have are maldistributed, with all the other costs that are associated with that. So it is our responsibility, one of our core responsibilities, to address this. And that's what I'd like to tell you about. Now, in neurosurgery, when we take the Lancet Commission report and bring it down to, well, what can our specialty do? This is our challenge. If 5 billion people don't have access to surgery, that means for the 70,000 or so neurosurgeons in the world, there are more than 5 million operations that are urgent operations that should be done but aren't being done now. So we need to address a manpower shortage, a person power shortage, because we need more women in neurosurgery, and we need to improve our educational systems and distribution of talent. You might say, that's too much. It's a huge task to bring surgical care to the 5 billion people who don't have it. But I would say to you, think about our colleagues in the business of pharmaceutics, our pharmacy colleagues who faced the COVID epidemic so very recently, where there were no vaccines at all. And think about what they did and how quickly they did. And doing something big, important, and well and fast like that is called having a moonshot, right? Having an ambitious goal and getting it done. And they did it. They took only 9 months to develop a new kind of vaccine. And look who their leader was. This is the CEO of Pfizer, who is a Greek immigrant to the US. He was raised by, his parents were Holocaust survivors. And Dr. Burla is not even a medical doctor, he's a veterinarian, but he makes the point in his book about how they responded to that moonshot, that the culture that they had already developed of courage, excellence, equity, and joy is what allowed them to be highly performing. And let's think about that as we think about our challenges. So I'm going to share with you the origins of this term moonshot actually come from President John F. Kennedy, who in 1962, I know he was beloved in Pakistan. The First Lady, Jacqueline Kennedy, visited here. They were big fans, as I am, of Pakistan. But the term moonshot comes from him speaking in 1962 about putting a man on the moon. As you know, the Artemis program now is going to put the first American woman on the moon. But the moonshot concept, which is where we are in global history, comes from this speech where President Kennedy said, and these are his exact words, where there is strife, prejudice, and national conflict in the world, they should not exist in my words, healthcare, which provides endless opportunities for peaceful cooperation. But why, some say, should we care about this? Why should we choose global neurosurgery as our goal? And this is that speech, September 12th, 1962. I hope they can hear it. Can you play it for me?
We choose to go to the moon in this decade and do the other thing, not because they are easy, but because they are hard. Because that goal will serve to organize and measure the best of our energies and skills. Because that challenge is one that we're willing to accept, one we are unwilling to postpone, and one we should win.
Thank you. Not a single one of you students in the room has shied away from something just because it is hard. In fact, you kind of like the fact that it's hard because that's the challenge of it. And so that's how we have to think about this challenge of 5 billion people who don't have access to care. This is really important. We choose to accept this, not because it is easy, but because it is hard. Because if we can respond to this as a global medical community and bring surgical care to traumatized people who need it, that will serve to organize and measure the best of our energy and skill. And I would say that that is a challenge that we are willing to accept. We are unwilling to postpone, and one we intend to win. So Kennedy goes on, but let me go on in the interest of time. We should not be deterred. We cannot expect, these words remind me so much of what you showed with your very founder here, Fatima Jinnah. No specialty and no nation, which expects to be a leader, can expect to stay behind in the quest for the highest quality for all its people. Sounds very much like Fatima Jinnah to me. So we take inspiration from JFK and the space program here. And so that's why I call global neurosurgery our moonshot. So we have shared knowledge. What are the tools that we have so that together we will able to move forward, advance on this goal, accept it, and win? We have shared knowledge. You're getting a great education. And in this post-pandemic world, there are great online programs. There are great simulations. We can do this. There's new healthcare delivery systems that are available. There's field clinics and hospitals and a focus on doing more with less. One of the things we're doing is expanding our idea of how you train a neurosurgeon, since we have an additional core responsibility to take care of those public health domains that are responsibility. We need to know more about the public health, so that those domains that are in our area of interest, so that we can lend our expertise to our public health colleagues and our elected officials. We're also looking at completely new and innovative ways of training. And we are very hopeful that there will be global or blended programs in the educational sphere, so that working across continents, we can use a reverse classroom technology and blended HIC, LMIC cohorts to learn how to do things best together, and then to do our hands-on together wherever the burden of disease is highest. Our journals are working in this direction. Journal of Neurosurgery, World Neurosurgery, that's looking at has special ways of addressing the implications of a practice that is not just focused on the patient in front of you, but also providing help, guidance, collegiality for those who are trying to take care of those patients half a world away and under different circumstances. We are also trying to expand and complete our understanding of what our field is globally. As a result of the pandemic and being able to look at neurosurgical outcomes in every country, we found these countries you see in blue and red where there has never been a neurosurgical outcome study. So we're systematically addressing that issue and going after those colleagues and working with them so that we can see what their outcomes are like and help them advance and bring their quality of services up to date. And then we're happy to say that just 1 year ago, our highest impact journal, Neurosurgery, actually created a global neurosurgery section. I'm honored to be the editor of that section. And we have a wonderful group of colleagues, including, as you can see, a senior neurosurgeon from Peshawar, who is part of the global reviewers group, who are working to recruit articles so that the rest of our colleagues can see what best practices are in every part of the world of neurosurgery. And I'm very proud of Dr. Tariq and of all of our colleagues. Now, let me in the center of the talk link what I'm saying about global neurosurgery a little bit more with spina bifida. Now, as I mentioned, in 2015, this was when the World Health Organization voted unanimously to strengthen access and quality of emergency and essential surgery. And this is why you see since 2015 that nations and professional societies have ramped up their efforts in this area, so that's why you're hearing about global surgery, global neurosurgery, global orthopedics and urology and so forth. So the progress that we've made in ramping up and developing a subspecialty of global neurosurgery has just been a phenomenon that started in 2015. One of our goals as neurosurgeons, we're looking to work with other stakeholders, because we certainly can't bring neurosurgery to 5 billion people by just working in our community. Neurosurgery must, within the pantheon, if you want, or the community of specialties, must sit just as it sits within a hospital system. You can't do neurosurgery without nurses and social workers and anesthesiologists and every other discipline that forms that team. So too, as we approach neurosurgical topics in a health systems approach, on a global approach, we have to work with all of the other stakeholders, and we want to do that. So we came together as neurosurgeons and said, what should be our first goal on a global stage that will allow us to make a contribution to build a big tent of talented, mutually supportive stakeholders and start addressing a surgical problem? And so we chose spina bifida, and I'm going to tell you a little bit about it. But the bottom line is the next WHA resolution was just passed in May, and it was a unanimous passage for every member, every nation that's a member of WHO, voted to strengthen folic acid fortification in order to try to eradicate spina bifida. Let me tell you how we did that. In just a moment here, though, one of the things that we have as a resource is working with our governments. And just an example of our government, bringing you my local example, we advocate within the US government, not only for improved resources for neurosurgical and all surgical care for US patients, but we also are working on getting a line item in the US federal budget for global surgery. It is part of our USAID package. It's something that we should be doing, and we are doing it. And this is just working with them. But back to the spina bifida story. So the International Society of Pediatric Neurosurgeons and the G4 Alliance, and the 4 stands for Surgery, Obstetrics, Trauma, and Anesthesia. It's a big advocacy organization for all of surgery. We thought, what can we do? And we looked at the fact that there are between 250 and 300,000 babies born every year in the world who have spina bifida and don't need to be. you can almost eliminate it. 80% of spina bifida can be eliminated by folic acid fortification of cereals, which people eat everywhere in every country in the world. We actually learned this from Costa Rica. And so we put together this group called the Global Alliance for Prevention of Spina Bifida F and started working just 3 years ago toward a WHO resolution. We looked and were inspired by our colleagues in Ethiopia who seem to have almost an epidemic of this problem, especially up in the Tigray area. And it turns out it's natural because they eat artisanal carbohydrates, teff. They don't buy fortified foods. And so they have huge numbers of this problem and not enough neurosurgeons to take care of it. So we wanted to address that. We started looking at, well, which countries in the world have laws where they've worked with millers and they have fortified foods available, and which ones do they not? And that map shows that. So we published many, many articles, including this landmark article in the Lancet, because what we wanted to do was bring together 30 years of class 1 evidence and public health data about folic acid fortification preventing spina bifida births and say, why haven't we done something about it? You all know from your basic science classes, it's great to have scientific knowledge, but until it's translated into individual practice and then into global practice, that scientific discovery doesn't help people. And that's what medicine is all about. So we published that, and then we had not an American, but a Colombian pediatric surgeon who was able to convince his government, this is Dr. Kemal Ghani, at a cabinet meeting of the president of Colombia, and the country of Colombia took this on as the first sponsor of the resolution. We did things like we took informatics from the CDC in the United States that showed how much human misery is stopped by this, but also how cost beneficial it was. And we created global informatics about this that we shared with all the ministries of health. And that led to our ability to be able to pass this law. And now we're going to work on TBI. So the G4 Alliance is bringing together these advocacy efforts of the surgical community. So there are other technologies that I'd like you to know about. You all have smartphones. Get them out sometime today. Type in intersurgeon and see what you come up with. It's using a technology platform, simple idea that everyone has in their hand to link up those who need help with resources, education, whatever it might be in order to help their patients, and those who have resources, who are giving courses, who have extra equipment that they can share, and bringing them together in a way that can facilitate moving forward faster and better together. So we have unique access. We have doors that are opened up to us, all of us, because we're physicians and we're trusted members of our communities, right? And so we need to be better at using those doors, that access that we have for the benefit of our patients. So we work at the World Health Organization. It may seem surprising, but it's only in the last 5 years that we have a neurosurgical delegation that goes to Geneva each year and makes sure that all of the ministries of health know what the needs are, the neurosurgical needs of patients everywhere, so that we as clinicians with bureaucrats and elected officials can align incentives in the right way. And I tell you, those bureaucrats and elected officials, they need your knowledge, your expertise, your patient experience in order to help guide where to put the resources of any given country. They need our help. So these are the global goals that we all share, the sustainable development goals of the United Nations, and they cannot be achieved without physicians, without the broader medical community, and we need to do our share. I want to share with you the fact that you don't have to be 30 years into your career. You don't have to be senior to make a difference. I want to share with you Priyanka Mathur, who is a Pakistani American medical student from Northwestern University, who gave our statement on the floor of WHO that led to this resolution. Isn't that a wonderful thing? I'm so proud of her, and I see people who look just like her, who have the same background as her in every seat in this room. And you see her with Dr. Tedros. She's now starting her career as an obstetrician, having already had an important role in policymaking and helping prevent spina bifida. So we have resources. In the US, on your left, that's a picture of NIH, and you can't have an academic career in any surgical specialty without having some contact with the NIH. That's a good thing. Our tax dollars should be going for the kind of research we do. But we also have local, regional, and local resources. At top, you see Cambridge University that has through the National Institute of Health Research, they have 30 million pounds that are being distributed to programs to look at better identifying how trauma, neurotrauma, both brain and spine trauma, is being managed around the world, so that once we have good data about prevalence, about how we're treating it, then we can design ways together to improve it. And I also come from the Barrow, where we had a grateful patient just give an enormous contribution that allows us to be able to think about how we bring our expertise at the Barrow to a district hospital on each continent to try to help with a grassroots effort to bring excellence to a local hospital in neurosurgery. And that at my home institution, George Washington University in Washington, D.C., we, one of our NIH grants is with Zambia, where we are helping our colleagues develop a national TBI registry so that they can help start to improve their traumatic brain injury outcomes by having better defined what the problem is, not getting overwhelmed by the enormity of the task. And then you have places like the University of Toronto who have responded to this by actually creating a pathway to full professorship of global surgery in all of the surgical subspecialties. And they now have 6 faculty members who are tracking through the departments of global neurosurgery, global ENT, global orthopedics, and so forth. We have the Global Neurosurgery Committee of the WFNS that just met actually in Peshawar, and we came down yesterday from Peshawar to join you here. But what we are doing is looking at those countries that have no neurosurgeons in the world, developing champions, because certainly there's neurosurgery going on there, right? There's trauma to the brain and spine, no matter where you are, whether you have a neurosurgeon or not. And so we are identifying those places, identifying the champions, and then trying to bring to bear to help those ministries of health and education and finance say, here's a neurosurgical community that wants to help. What can we do for you? So I hope some of you will be on this journey with me. Check back in a couple of years. We'll have made some progress on that. So as I conclude, these are some of my students, fellows, and mentees. I see future ones out there. There is literally nothing that we can't do with if we pull together, and especially if we pull together with women, because for the long history of medicine, there have been individual women standouts, like you talked about in the 7th century, but we haven't fully realized the potential of medicine to be able to help cure human ills if we don't use half the population and which we haven't exploited up to this point. And at a university like this, you're just in the driver's seat to be able to affect real change in real time very quickly. So let's close. This is a video as well, but it's just 10 seconds to get you excited about our moonshot together, which is to try to address this gap in surgical care and achieve our moonshot. That's Apollo 11, the one that successfully did reach the moon in 1969. As I said earlier, there's a woman on the next one that's going to be reaching in the moon. Thank you.
Thank you, Professor Gale, for a most inspiring talk. You have Priyanika over there, and we have Fauzia over here. And there are many Fauzias and Priyanikas sitting in the hall. We will like to dedicate a verse from one of the very famous revered poets of the world, the Shair-e-Mashriq, poet of the East, Allama Muhammad Iqbal. And I would like all our students to join me as I read out the very famous verse he wrote for women. It goes, "Wajood-e zan se hai, usi ke saath se hai, zindagi ka soze." So it means that wajood-e zan se hai, tasveer-e kainat mera. Wajood-e-Zan, it means that all the colors of the universe are because of existence of women. Usi ke saath se hai zindagi ka soze daru, that it is her instruments which leads the grand orchestra of life. So this goes out for you, dedicated to you. As we draw towards the end of today's seminar, I'll request the chief organizer, Professor Hamid, to kindly come. Professor of Neurosurgery, thank you, sir, for organizing this. He would come here for the distribution of souvenirs and vote of thanks.
Thank you to everyone be here. But before the vote of thanks, I would like to request my worthy Vice Chancellor, Professor Noor-ul-Huda sir, to be on the stage for presentation of the souvenirs and the shields to our worthy guests. And Madam Principal, Madam Balkis, I would request Professor Gale for her seminar.
Wow.
I would request to present the shield to Professor Franco. So ready. Now I request to present the shield to Professor Richard Moser and Mrs. Richard Moser. Please. In the end, I request my worthy Chancellor, Vice Chancellor to present the shield to Professor Naveed Ashraf and his son, Dr. Muhammad, for both of them for their very marvelous facilitation for this event. Now a very esteemed presentation of CPSP souvenir to Professor Gale by our worthy Vice Chancellor.
Just wanted to show you.
It's technology is distance is not making a problem. Next time, Sarah, I will be honored to do this. Yeah.
So, for a lot of thanks. In the end, ladies and gentlemen, esteemed guests and cherished participants, as we draw the curtains on this outstanding talk, I stand before you with a heart full of gratitude and deep sense of appreciation to Professor Gale, who has no doubt inspired an entire cohort of doctors who I am sure will take the principles and values she has demonstrated in their professional lives. Today has been a momentous day for our institution, made possible by the collective efforts, enthusiasm, and support of each and every one of you. To our worthy Vice Chancellor, Professor Khalid Masood Godal Sahab, our Principal, Professor Noor-ul Akmal, my friend, Professor Naveed Khotiana, respected Director QEC, Professor Bilkis Shabil, and our family of faculty of Fatima Jannah Medical University. Thank you for facilitating this event. And finally, our students who came so enthused and eager to learn, I'm grateful for your patience. To Dr. Gale Rousseau, Dr. Franco Savedi, and Dr. Richard Moser and Mrs. Moser, who came to our historic city, we owe you gratitude for your effort in the development of global neurosurgery. A philosophy which is simply put to improve access to high quality care for everyone, everywhere. Your contribution has enriched our understanding and added a layer of excellence to the proceedings. I am very much thankful to my colleagues, Professor Asad Bashir from the PINS, Professor Fozia Sajad from the Allama Iqbal Medical College, Professor Shahzad Hussain from the PINS to be here to grace this occasion. In the end, I'm very much thankful to Professor Naveed Ashraf and his son, Dr. Muhammad, for this marvelous facilitation for this event. Thank you very much for this chance. Now, there will be tea for the students outside this,
And there will be a faculty photograph outside the VC office. And afterward, the tea will be served to the faculty members in the concert room. Thank you very much.